and one of our representatives from Lake After Hours, Dr. Graham Tujague, joins us here on Louisiana Prep Weekly. Doc, how are you doing tonight?
Good evening, guys. How are you doing?
Doing good. It's that time of year again, Coach, where I'm calling you Coach. I guess, in a way, you are a coach to some of these guys who are, and girls who are going in, getting ready for the football season, getting ready for, basketball that's going to be coming up. Volleyball is going to be coming up. Physicals are oh so important, and it almost becomes like, a broken record. But if you could, Dr. Tujague, tell me why are physicals so important at this stage of the season?
Well, it's a great screening mechanism to check the children to make sure that they don't have any kind of congenital anomalies, something like their eyesight that may cause problems with catching the ball, some hypertensive issues, potential cardiac issues, and a common one that we do come across is asthma or lung-related problems that can pose some problems for the children. We commonly do physicals here at Lake After Hours for sports-related events. In fact, we're running a special right now on half price for physicals, and we're donating $5 back to the school of their choice. It's $25 physicals, and that's half price with the normal price here.
Well, that's a great deal. I know the schools are certainly appreciative, and it's really a great opportunity for students, schools, to get involved. And our good friends over at Lake After Hours. Dr. Tujague, you mentioned some of the things you guys do as far as physicals and some of the things you can check for. Can I go as far as saying that you can maybe help prevent something a little bit further down the road? Maybe you can see something in a physical that you can say, hey, this seems a little out of place, whether it be, as you mentioned, something with asthma or, a lung situation, maybe a heart condition, where you could at least give some warning signs to a player or a coach and a team, be careful with this.
Sure. And we often would refer those out to the specialists, mm-hmm. The lung specialist or the cardiologist, who would pick up a heart murmur, for example. If you have what they call a murmur, which is a blood flow leakage in the valve, or if you might pick up some type of irregular heartbeat, in which we would send them off for a referral to a specialist, and they would put them through a battery of tests to make sure that everything would be okay.
No, Dr. Tujague, this is Todd Black, and obviously one of the great things about using Lake After Hours is there are many locations around the capital city. You don't need an appointment. You walk in when it's convenient for you, and you can be seen, correct?
That's right. That's right, Todd.
And how many locations do you have around the city?
We have 11 locations. 11 locations all the way from Hammond to Brewley and Zachary and Denham Springs, and in the inner city area around Drusilla, we have Coursey Boulevard,
Perkins. I won't put you on the line to name them all because they're counting them. Your partners that are listening are saying, all right, he missed this one, so I'm not going to do that to
okay.
you. But the point being is they're all around, and just, hey, after practice one day, preferably, I'm sure they would prefer before practice, go by to one of your Lake After Hours and get your physical taken care of. One of the other reasons we have Dr. Tujague on today is to talk about hydration. And, Cade and Dr. Tujague, more and more each year, we unfortunately hear about kids, college players, even professional players having a battle with the heat. Sometimes it doesn't ends up in death. Dr. Tujague, what can players do, and what can parents get their sons or daughters to do prior to the football season to help stop some of these heat-related incidents?
Well, the simple answer for that would be hydration. There are some recommended guidelines to suggest as far as hydrating status. I believe it's like 24 ounces of water 1 hour prior to participating in a sporting event during the summer, and then another dosing, if you will, about 16 hours or 16 ounces, 15 minutes prior to participating in the exercise event. And then, of course, you have to rehydrate during the exercise event quite frequently. I think the recommended hydration recommendations are every 15 minutes. They recommend drinking another 8 ounces of water, Powerade, Gatorade, any type of fluid. I'm not so sure that any of them are better than the other.
Just not Cokes, right?
Yeah, I wouldn't recommend Cokes. No.
So a couple Dr. Peppers at halftime, not a good idea. Lake After Hours, Dr. Graham Tujague joining us here on Louisiana Prep Weekly. Coach, Doc, how often do you guys get involved with concussions, and is that something you recommend to a specialist, or can you, if a player comes off the field at practice, has a concern, parents or coaches have a concern, can they go by at least and get an idea from you guys?
Oh, yes. And we do that quite frequently. My son goes to Catholic High, and I've had a couple of his lacrosse teammates come in last year with, a concussion, more of a traumatic brain injury. Of course, there's different degrees of severity. It could be very mild, which would be like a mild amnesia event and difficulty concentrating, to more severe, where you had amnesia for a prolonged period of time, even up to a day or so, with nausea, vomiting, double vision, and just having trouble concentrating, and that could last up to a week or so. It's not uncommon to hold someone out for a week at a time until they recover. Now, we do the screening thing here at Lake After Hours, but if it would require further testing, we would send them to a neurologist, which would be kind of like a concussion expert.
Dr. Tujague, before we let you go, Lake After Hours, right now, because my children aren't old enough, they don't help it with the concussions, but with my dog causing stitches with my kids, causing wounds, y'all have been saviors. So what else, other than, the type of injuries that we talked about, Lake After Hours have saved me and my family. I had tons of worries by being able to come to you guys, getting stitched up, that type of thing. What else you guys like to provide the community?
Well, one of the common misconceptions is that, we can take care of a slew of not only injuries, but illnesses as well, cough, fever, pneumonia. We have X-ray capabilities where, for sporting events primarily, people with swelling of the knee pain, ankle pain, turned ankles and all that, we normally will do an X-ray and we'll splint them and put them on crutches and refer them out to the orthopedist if it's recommended. But all kinds of stitches, something in your eye, trouble with your vision. It's a great kind of screening environment. And we have to send some people to the hospital on occasion, but it's not very often.
Well, Dr. Tujague, before we let you go, give us an idea on that special you guys are having right now.
We're running half-price physicals, and they're up $25. And this will be valid through September, the 1st of September. And this is for football physical, any type of physical for the child, physical, volleyball, basketball, football, spring, fall activities. But this is good for $25, and then we're able to give $5 back to the school of their choice at any of the locations.
Well, Dr. Graham Tujague, we really appreciate your time tonight. Really appreciate the support of our friends at Lake After Hours. Having you guys on board is real important, and thanks for being on board for another season.
Well, we really appreciate it, and y'all have a great day.